Hello, and thank you for tuning on to the Kosh TV on YouTube. This channel is aimed at improving the well-being of the family and the community as a whole. Please consider subscribing, sharing, commenting, and liking. Okay, today I am going to talk about something we the health professionals do nearly all the time. Could be on the ward, the community, any other healthcare facility. It is the assessment or the monitoring of the cardiovascular system with the circulatory system. Sometimes we do this in conjunction. We do know that the cardiovascular system cannot function without the circulatory system. Okay, hence my title, assessment of the cardiovascular system with or and the circulatory system. Okay, so how do we do this? I'm going to start first with how this is done in the community. Let's say the primary health care. Now, if your GP or your healthcare provider is concerned about how your system works, your cardiovascular or your, for the purpose of this video, so that a bit more people can understand, I will be using your blood pressure or BP. Okay, so if they are concerned about something like this, they would proceed with monitoring of how it works. First, they would like to know when, how, and how frequently your blood pressure rises or your pulse become too rapid, which we would say tachycardia, or when it becomes too low, which we say bradycardia. Okay, and they will take into consideration other underlying health conditions. Sometimes some underlying health conditions do affect how the system works. So, if your doctor or any other healthcare professional is worried about the level of your blood pressure, they will proceed to do some initial blood tests, that's investigations, right? Before they actually put you on any medication, especially where blood pressure is concerned, they will be doing one or all of the following. They'll be checking your blood pressure and your pulse regularly, depending on what they are trying to investigate, or they will put you on equipment we call the 24-hour tape. Okay, so the doctor may advise you to be checking your blood pressure regularly at some intervals at periodical time level. Let me take that again. Your doctor or healthcare professional may advise you to check your blood pressure at certain times of the day, or they may put you on what is called the 24-hour tape. Okay. The purpose of this tape, or the aim of this tape, is to record how the system works. That's your circulatory system, your heart works. Okay, you will do this over a period of time. Okay, from my knowledge, it's usually ranges between 24 hours to about 72 hours. You would be put on this, and the machine will be recording your blood pressure and your pulse. I'm not sure if it does the respiration as well, but I do know it does do the blood pressure and your pulse. So this is done over a period of time. Okay, sometimes if you would have to be probably be doing some sort of work, if you have to be at work and you wouldn't be able to record at certain times, they may give you certain times of the day which is convenient for you to be recording or writing down what you were doing at that particular moment or time. Okay, so after you've worn this, it usually comes as a belt. You put it around your waist with the machine, which will be doing the recording. I'm not sure if there is anything like that for the arm though. I'm yet to know. Then after the duration that this is supposed to be worn, you take it with your recording to your healthcare provider. Mostly in a situation like this will be your doctor. So upon the assessment, together with the blood test that you have done, they may proceed to put you on treatment. All right, so this is what is done in the community. Aside this, what we also do in the community is if you should have someone visiting, let's say a district nurse, a community nurse, or if it's a residential home, mostly what we use is the SFIG or the Dynamap, which we've come to know because of technology as the Dynamap, which does most of the recording that the SFIG will do. The SFIG usually just does the blood pressure, but with the Dynamap or the monitoring machine, this will do your respiration, your heart rate, your blood pressure, and will also do your oxygen saturation. Okay, so these things are usually taken into consideration to assess whether you were doing well or you were not doing so well. To include this, depending on how experienced whoever is doing this assessment or monitoring is, they may include any underlying condition. I'm talking about things like if someone has had renal problems and is probably going under dialysis, someone has got problems with the liver, and let's say an advanced form of liver problem in terms of cirrhosis, and has developed ascites, all these things are taken into consideration before maybe an expert is called in, or before a decision is made. Okay, so that's me touching on the community briefly. Okay, now I'm now talking directly to my colleague, healthcare professional nurses, nursing associates, doctors, and especially new doctors and trainee doctors, right? So in a healthcare facility like a hospital, okay, if you're working in the hospital and you are looking after a patient, we all do know that assessment forms a big part of a final diagnosis. Okay, assessment over a period of time, including blood investigations, form a big part of coming to a diagnosis. Okay, the other thing that forms part of making a good diagnosis or making a good judgment will be any underlying condition. Sometimes they may be terminal, Sometimes there may be something that is being managed and well under control, and in certain times it could be a new onset, okay, of a problem. Okay, I'm talking about problems like renal. I tell you, renal conditions does affect the system very much. Okay, hopefully in good time we would have someone to talk a bit more about this. And the liver, okay, the brain, yes. Though things concerning the brain are mostly dealt with in special settings, say they are seen by specialties, but in this condition, in this instance, I'm talking to all health professionals and nurses out there. When we are taxed, or when it comes to your responsibility as to monitoring patients' cardiovascular with the circulatory system, we need to be mindful of certain things. All right. When you see the patient, first, what jumps at you? Okay. When you see a patient, sometimes you will see the patients may, depending on how sick the patient is, the person may have flushed skin, sweaty, clammy. Okay. Now, eyes, sunken eyes, which may mean a form of dehydration or malnutrition. Dry mouth. Yes, there has been a condition where patients have had dry mouth, or they're so hydrated that sometimes, depending on what the patient is suffering from or what the individual background history is, dry mouth, or I'm trying to find the breath. Okay, the breath of the patient can indicate so many things. So we need to put these things into our nursing assessment. Yes, there must be sometimes there rather the situation where probably the patient isn't able to eat much. Okay, the patient isn't eating much, so the patient may be malnourished, and the fat, okay, the fat that the patient has got is being broken down, which can bring us some sort of breath. Or the patient could be a diabetic and you may find an acetone breath, so these things sometimes can actually help in making a good judgment for a diagnosis. Okay, now let's take into consideration any background history. Okay, high cholesterol, a history of high cholesterol, or even family history. Is the patient already known to the facility and maybe going through or maybe receiving some form of treatment already? Okay, before moving to your department with another condition, we need to factor all this into our assessment. If the patient is a renal patient who may have come to your department for the treatment of a different condition, let's take maybe a patient has developed a rash, and you need to take a blood pressure, need to assess the patient. You need to be able, you have to document that this is the situation, and the patient background or background blood pressure also forms a part of your decision making, or whoever is assessing the patient decision making process. All right, there are some individuals who normally do have low blood pressure, no medical background, healthy, they are healthy, moving around, and naturally they just have low blood pressure. Okay, and there may be some people who may have developed some other condition and has led to low blood pressure, or they have suffered high blood pressure and it has actually which was an indicator of a condition but led to something else, and they have come to you. All right, so in assessing this and in your communication with the patient, we have to make sure we document all these. Yes, sometimes time is the essence. You do not have time to ask all the needed questions, but we need to be careful and we need to be sure that we ask the right questions. That is why in most of my presentations, when it comes to assessing of patients, I always talk about the S-bar. Use that and you may in most situations have covered everything. All right? Okay, so how does the patient appear to you in your assessment, taking your blood pressure? What do you see? Do they have edema of the limbs, lower limbs? Okay, or is the edema just to one hand or one arm, upper arm? Let me use the right arm here, upper limb. Okay, you may not, you the nurse or you the healthcare assistant or nurse associate may not know what it means, but when you see it and there is the possibility of you documenting it, make sure you do put that down. Okay, it's very important. Now, has the patient got a catheter? Okay, in doing your cardiovascular circulatory system, all these come into play. Has the patient got a catheter? Have you had a look at the fluid chart? How much fluids, or are you aware of how much fluid the patient has had? Okay, and the catheter, how much is in the catheter bag? The color, important. Okay, are you concerned about the color? You document these. Is the patient taking in oral fluids with the IV fluids? And is there the need for the patient to be having both? All these must be taken into consideration when we are assessing our patients. Now, the pulse. When you check the patient pulse, what did you see? Now, with the Dynamap, it will give you the heart rate. Yes, so convenient. We document that and off we go. But have you taken the time to actually touch the patient pulse to see if it is thready? Is it bounding? Is it regular? Is it irregular? Or is there any form of tachycardia? Because the machine will work in a certain way and it will give you a figure, but the feel of the pulse will tell you a little bit more. Okay, yes, in an instant like this, it has to take an experience to actually know if the pulse is thready, bounding, or weak. Okay, so you, the experienced nurse out there who is able to do this, if you've got someone with you who doesn't really have any knowledge of this and can't do it, after they've done that, you also do your assessment. You come to the patient, you give medication, you do other things. So take the opportunity to feel the pulse. It takes just a few seconds just to feel the pulse. So I'm trying so hard not to make my video so lengthy because it can be a bit boring, especially if you are not too into the clinical or medical side of things. So let's try and document our assessment properly. Let's try and then put down any variations. Let me quickly touch on this. You may have a patient who may weigh less than 50 kg or just 50 kg, an adult patient. Of late, we do have this monitors, pads, devices on which we record our observations. Now, this pad will usually trigger off an alert to a central point, or to a central point. Let's say if you are stationed in a particular unit department, and then say there is a problem if the observation do not fit within the range that they should, as recorded or as programmed into the device. Okay, so if this patient is under weight, it's a small, let's say built for age or size, okay, doesn't fit into, because I have been in that situation, that's why I thought I should bring this across. Document, unfortunately these devices do not have the you can actually not put in written words to actually explain, or there is no any text, unless there are some new ones that I'm yet to see, to say the patient is under this weight or the patient is over this weight. Okay, so if you look at it critically, for a patient of that size, whatever your figures are may be normal to the patient. Whatever your figures are may be normal to the patient. And when you look at your figures and you see your patient is alert, communicating, walking to the toilet when they need to, they do not show any sign of concern. However, if this communication isn't done, okay, and it goes to the central point, someone may be rushing over to find out if all is well. Okay, so if there is the opportunity to actually document and say that the patient is under or weighs this amount kilograms, this would reduce unnecessary worries and anxiety in our clinical settings. Okay, I just thought I should put this across. So when we are assessing our patient, let's factor in all these things. Sometimes we tend to forget because we feel they are not necessary, or the workload may be so much. All you want to do is that you have been tasked to do blood pressures or the observation, so you do that and off you go. No, let's make sure, in a way, this is a legal document and it's protecting you as well. So let's make sure we do all these things that I have mentioned and then communicate them appropriately. Thank you so much for listening to me, and to my dear nursing colleagues out there. Let's keep up with the good work. Until I come your way again, I say, look after yourself. Make sure you're well hydrated as you are at work. Take breaks when you can. Alright, please take breaks, because you cannot work when you are low on fuel. Okay, as I always say, remember, you and your community are responsible for your well-being. So make it a point to be a positive impact or influence wherever you are. Stay healthy, and I'll come your way again soon. Bye-bye.